Hi, my name is Dr. Saf. How you define acute coronary syndrome? So that's very simple and but very important definition to understand. So acute coronary syndrome is a spectrum of coronary artery diseases which share common pathophysiological mechanisms, and these mechanisms lead to partial or total occlusion of coronary artery. If this occlusion is partial, that can lead to two types of coronary syndrome: unstable angina and non-ST elevation myocardial infarction. So these two types of acute coronary syndrome are due to partial occlusion usually, but they are different. So in unstable angina, the pain is very characteristic, which is of longer duration, and that pain is usually associated with some sympathetic response like vomiting and autonomic disturbances, okay, basically. And it is very severe, it is retrosternal, and it is frequent, it is for longer duration, it can occur even at rest, and it is not subsided by the usual painkillers. But remember that in unstable angina, though there are ECG changes which are positive for ischemic myocarditis, like there may be STT changes, ST depression or T-wave inversion or T-wave elevation or T-wave flattening even, but there won't be any markers suggestive of myocardial injury. That is very characteristic of unstable angina. So in unstable angina, there won't be any myocardial damage, whereas in non-ST elevation MI, there are ECG changes which may be similar to unstable angina, but there are markers which are positive, like troponin I and troponin T are positive in non-ST elevation MI. And at ST elevation MI, which is of the most severe form of acute coronary syndrome, may be due to total occlusion of coronary artery due to complete plaque rupture. So that this plaque rupture leads to various cascades of clot, formation, and that leads to total thrombotic occlusion of coronary artery, and that leads to large area of myocardial damage, myocardial dysfunction, myocardial injury, which will be reflected in ECG as in a form of ST elevation, and also the cardiac markers of ischemia will be very high. For example, troponin I and CKMB will be very high. So now, in a nutshell, you know that acute coronary syndrome consists of three important types in the order of severity, from low severity to high severity: unstable angina, non-ST elevation MI, and ST elevation MI. So when you have unstable angina, you have to be worried, though the trop T is negative, but definitely there is a occlusion which is partial, and that may probably be resolved by the medications. And these type of patient will require angiography in future, and unstable angina is a harbinger of myocardial infarction, acute myocardial infarction. So that's important point we should remember. So that's all. Thank you so much for your attention.